Hi, everyone. I'm Dr. Rubin. I am a Harvard-trained dermatologist and the founder of SEEN Hair Care. And we are so excited that you're joining us today and have a discussion with Dr. Maryanne Senna, who is a really just incredible hair loss expert. She is the director of the Lahey Hair Loss Center of Excellence and Research Unit at Beth Israel Lahey Health, and she's former co-director of the Hair Loss Clinic at Harvard's Mass General Hospital. Welcome, Dr. Senna. And just for everyone, if you have questions, please put them in the Q&A box instead of the chat. So we'll get started today. We are talking about SEEN's hair loss study that just completed at Harvard, and Dr. Senna was the principal investigator, and we're going to be sharing the findings of this study, looking at SEEN and how it promotes hair health and reduces hair shedding. I'll start with the headline and then we'll go into the study. So this was a 6-month trial, randomized controlled study, and we'll get into what that means, looking at women with hair loss. And in the group who had female pattern hair loss, SEEN reduced shedding by 44%. And if you look at the numbers, that's actually over 11,000 less hairs that you would lose a year, which is basically about 10% of the human head. So really dramatic findings, and we have Dr. Senna to help us understand the study. So thank you so much for joining us.
It's such a pleasure to be here. And Iris, I remember probably a couple of years ago when I found out about from another colleague at Mass General that you had been a resident there and trained there and that you had started this company. And I thought, what a great idea, because I had had this hunch for a long time that in addition to treating different forms of hair loss, including female pattern, using products on a daily basis that don't clog pores, that don't have potential irritating or allergenic ingredients was really an important piece. And I was thrilled when I came to you and said, let's do this study, that you agreed to do it.
Yeah, no, I love, like, before we got on, I was thanking you for doing this study and you said girl power. And, let me just say though, like, I am all about women supporting women. And I think that's like, just so important, but you have been, you were not paid personally to do this study. I know that personally hair loss is something professionally and personally that's really important to you. And this was just an unmet need. So like, super grateful that you've done the study. And yeah, I mean, I'd love to get into how SEEN helps with, and we're gonna talk about hair shedding because SEEN is not medicated. So that makes the results even more dramatic. The fact that you can change to fragrance-free SEEN shampoo and conditioner and reduce shedding by 44% is crazy. So Maryanne, can you share a little bit more about why you came to us and thought this product could help women who have hair loss?
So, the hair follicles are a natural opening to the skin, right? And products that we put on our scalp can block those hair follicle openings and I think affect hair health and hair growth. But also a lot of products that are on the shelf contain ingredients that can actually be kind of noxious to the hair follicle and also impact growth. And for some people, that leads to frank scaling and itching. But in a lot of cases, it's much more subtle than that, but it can impact hair health and hair growth. And so for a long time, I thought about that. And when I heard about your products and had a first conversation with you, I love the fact that your products didn't contain any of the ingredients that we tell our patients to avoid who have hair loss. And I also love the idea that your products don't leave as much buildup on the scalp, right? So they clean without being harsh, they're color safe, and then they're also not clogging those hair follicle openings. And to me, it just made sense that that should help patients who have hair loss as a part of their regimen.
Yeah, no, it makes sense. And, I actually created SEEN because I was getting acne from my hair care products. And I'm like, it's crazy for people who are acne prone to basically be dumping hair products all over their hair, which, we did a study that hair products leave a residue on your scalp and skin. And that residue can clog the pores or irritate the skin or have certain allergens. But candidly, SEEN, initially was not created to benefit hair shedding. We kept hearing these reports though, of people, even my twin sister actually, had a dramatic improvement in her hair shedding. We kept hearing these reports, but it seemed really about the science. We never make a claim without having the study. And that's why it's so exciting to have a Harvard study. And, I don't know how many beauty companies do a randomized controlled trial. And, we've heard from people like, SEEN has changed my life. I never thought I'd say that about a shampoo company, but we don't actually consider ourselves a hair care company. We really consider ourselves, a science, meets beauty kind of crossover.
Yeah, and that's what I really liked about you. And I just want to make it clear to everyone in the audience, I'm not paid by SEEN. I haven't, made any profits off of any of these products. I have a very personal connection to hair loss, which is why I'm so passionate about helping people who have it, because I have personally had alopecia areata, which is an autoimmune form of hair loss. I've had multiple family members who from very young ages have had really bad female pattern hair thinning. And what bothers me so much is that there's a lot of products out there that don't have evidence to support their claims, that people, this is like a multi-billion-dollar industry. And it was really important to me and continues to be important to me that if I have a hunch about something, let's put some evidence behind it. And that's exactly what we tried to do here. And what's important for the audience, I think, to know is that, as Iris mentioned, as Dr. Rubin mentioned, this was a randomized controlled trial, which means patients who came into our clinic were offered the opportunity to participate in the trial. And like a flip of a coin, a computer randomized them, meaning they randomly got assigned to either use SEEN products or not. And I did not know. I was blinded. I had no idea what they were doing. And when they would come back into clinic, we would do the gradings. Patients would answer their shedding scales. I would evaluate them. And we didn't collect the data until the very, very end, 6 months later. So that's really very important because there was absolutely no bias entered into this, either from the point of financial incentives for me or me knowing what patients were using. And I think it's very important that if you're going to spend money on products, you use a product, you're knowledgeable and understand how a product is supporting its claims. And so I'm really proud of this work, actually.
Yeah, I mean, Maryanne, I think like you're doing a huge service because like the fact that we have the data, to now put this product in the hands of people who really could benefit from it is huge. And, hair loss is personal to me too. My mom, you've actually seen her as a patient because I think you're like the best. My mom suffers from really bad female pattern hair loss. She has tried everything. I mean, if you told her to do pretty much anything, she would do it. And, it's emotional. It affects how you feel about yourself. It's physical. So yeah, to have a product that actually works and is non-medicated is huge. Are you aware, are there other like non-medicated products that you know of on the market that have like science and data or that you
not like this? Yeah, not like this. I mean, nothing I think comes close to the type of study that we ran, because it has to be rigorous and well done. And, we had institutional review board approval, which means an ethics committee of physicians, of lay people had to approve the study for it to be done. And so, like I said, I'm really proud. I think one of the best statistics too, I know you mentioned the hair shedding, which is absolutely huge. And I was shocked by the difference in the two groups with the hair shedding, because that's one of the first signs that women notice when they're going or experiencing hair loss. So that was enormous. But another really great statistic, I thought, which was statistically significant, meaning not only did it occur, but it was actually a meaningful difference between the two groups, was that the women with alopecia or hair loss who are using the SEEN products said that they noticed an increase in their hair volume and actually felt like they didn't have to use camouflage and products as much to cover up their hair. And that is so great because, like you were alluding to, that's one of the hardest things that women deal with when they're having hair loss is how am I going to cover it up, go out in public, etc.
Yeah. And actually on a personal note, my mom actually bought a wig, and this is right as we were launching SEEN. And I said, Mom, just try SEEN. And she was able to get enough volume where she didn't have to wear the wig. And we did a separate study also using shampoo, conditioner, or blowout cream, and it showed 300% increase in volume. I think it's because also you're not, there's no heavy oils and no silicones to weigh down the hair. But if you are suffering from hair loss or thinning, you want the hairs on your head to look as good as possible. So I think that the volume was amazing. And then, we were talking also about the camouflage, how there were two groups in the study, female pattern and then scarring hair loss. And when you put them together and ask them about having to camouflage or, cover up their hair, they felt that they didn't need to anymore when using SEEN. And, it's huge for us. We're actually called SEEN because if your hair or skin don't look good, often you're like this. Like for me, it started with acne. Actually, I have pictures when my daughter was born. I don't even like to show the baby pictures because I'm all broken out, but it doesn't, if it's your skin, if it's your hair, you want to feel comfortable being seen. So that, I think that's a pretty remarkable result as well.
I agree. And, I think too, I think a lot of the volume too, I think I mentioned to you previously, most women or a lot of women who deal with female pattern hair thinning and hair loss will complain, gosh, I have to wash my hair every single day because my hair gets greasy and I can't go more than a few days. And that was another thing that we heard a lot. And that I hear from patients of mine who use products is that, they don't have to wash their hair as frequently. And I think that's related to, the lack of like the silicones and things that you were mentioning that can cause buildup, but also kind of clog the pores. So it's great.
Yeah, and my twin sister makes fun of me for describing things like this, but I always think of the follicles as the manufacturing plant for the hair. And so why would you clog the pores with and I think many traditional hair care products do have ingredients that can clog the pores. And I wish it was as simple as if you avoid these top 5 ingredients, you're good. But we found at SEEN that the way ingredients combine and thresholds of ingredients matters. And that's why we test finished products for what's called comedogenicy. So you don't want to clog the pore. And then, you were actually the first one to really make me aware of the importance of the irritants and allergens, because there are some types of hair loss, scarring hair loss, that have been associated with different irritants and allergens. But, it just makes sense that you have to respect the follicle. I mean, the scalp is skin, your hair is actually dead, but your scalp is alive, your follicles are alive. Why would you, basically help out what's dead and damage what's living? It just doesn't make any sense.
Yeah, I agree with you. And yeah, I mean, like I kind of mentioned earlier, there are these, types of hair loss that can be due to inflammation. But even with female pattern, there's no benefit to having these potentially irritating or allergenic ingredients in products. And so, I always recommend that patients use them when they don't contain those ingredients too.
Yeah. I've read studies because, again, my mom suffers from pretty significant hair loss, and so she'll ask me about anything that comes up. So I remember reading some studies for some devices. Some devices may work, but one particular study where it was statistically significant results, but it was so few hairs that I'm like, you would have to use this for 6 months to get so few hairs. But can you contextualize 44% less shedding? Is that something how significant is that in terms of someone and how they would feel about their hair, and how significant is it?
Yeah. So with female pattern hair thinning, one of the very first signs that women will report is seeing hair everywhere on the floor, on their pillow, right? More hair in their shower drain. And the reason for that is because on average, our hair should stay in the growth phase before they shed for about 3 years. Okay. And what happens in female pattern hair thinning, for a number of different reasons and factors, that growth phase shortens. So rather than 3 years, it's 2 years, 1 year, 6 months, 1 month.
Yeah.
And that's where that term miniaturization of hairs, where these wimpy, skinny, short hairs are growing, but then they're shedding. They're not staying in the growth phase long enough. So with whether it's medications that we prescribe or the treatments that we do, or certainly with what we saw in this study with the SEEN products, the reduction in shedding is an indicator that the hair is staying in the growth phase longer. And that's exactly what you want to combat hair loss and hair thinning. And,
Yeah.
and I was really in shock when that data came through. I'll be honest with you, Iris, I had a feeling like, that there would be something, but, basically what we saw is that the people who use SEEN reported a reduction in shedding of like 122 hairs per week. And the people in the other group not using SEEN had an increase of 102 hairs per week. And as you were saying, like over time, over a year, that's like 10% of the hair on your scalp. That's like an enormous difference. And if you look at, what a clump of, 221 hairs looks like that SEEN group was saving, that's enormous for people who are struggling with hair loss. So I just found that to be a really compelling part of the study that, to be honest, I wasn't expecting, but was really excited to see.
That's cool. Yeah, we love, results that are surprising. And, we talked about this, but SEEN really is not a marketing story. I mean, I trained at Harvard. I was a pediatric laser surgeon working at Children's, treating babies and kids with disfiguring birthmarks and scars, and never in a million years did I think I would have a product line, but I think it is really an unmet need. And, the options for hair loss are not like, there's good options, but why it's kind of like stepping on the gas and the brakes at the same time. Like if you're seeing a hair loss specialist like yourself, or dealing with hair loss, and you're, using medicated treatments, like, and then you're using products that clog your pores or have irritants or allergens that can affect the follicle, it's kind of, it doesn't make a lot of sense. You're not like optimizing, your regimen. And again, SEEN is not medicated, but I think it can really fit into to the regimen for someone who is dealing with hair loss.
Yeah, and one thing that we kind of hypothesized too, and is maybe the reason why women were doing better who are using the SEEN products too is like if you're not clogging those pores, well, maybe the medications that you're using are penetrating the scalp better, right, and are able to work more effectively. So that was one thing that we thought about, but certainly the shedding is just like very, very impactful. And like I said, that's one of the first signs that things are really going in the right direction with the hair loss treatment.
Yeah, no, that is such an interesting point too, because if you're, let's say my mom uses, for example, topical minoxidil, you're basically like allowing that to be more effective and penetrate better. And it's interesting that we're talking about that because, I've asked you what works for female pattern hair loss. And I think one of the leading edge treatments is actually minoxidil, but orally. If you could comment on that, since we're, talking about minoxidil.
I mean, so I think the first important point to make is, I'm a board certified dermatologist, like Dr. Rubin, but not all general dermatologists are hair loss specialists. And so just going to a dermatologist, you might not have the same experience as going to someone who really focuses on hair loss disorders. So I would urge anyone in the audience who's struggling with hair loss to make sure that they're seeing a board certified dermatologist who also knows hair loss and treats hair loss patients. Importantly, women are often told, oh yeah, there's nothing you can do about this or whatever. There's plenty of things you can do for hair loss and hair thinning. And Dr. Rubin was alluding to that. So while the only FDA approved treatment is topical minoxidil, or goes by different trade names, which is over the counter. There are off-label treatments that we use all the time with great safety, tolerability, and efficacy, like oral low-dose minoxidil, which women can often prefer because it doesn't gunk up their hair. Oral spironolactone, even in low doses, can be very effective. And other things as well, like platelet-rich plasma injections, and other things as well. And obviously optimizing things like iron, vitamin D, when those are low, and using a clean hair care regimen too as part of that process, people can have really amazing results.
That is so important to hear. My mom's probably listening, but she's about to start low dose oral minoxidil. But yeah, she asks me about probably every supplement known to man. And we actually get a lot of SEEN customers emailing me also, because they'll have, a benefit. They've noticed improvement in their shedding, their volume, and they really trust us and ask. And are there any supplements? I know you talked about vitamin D, iron, thyroid. Beyond like those labs, are there any supplements that you found helpful?
Yeah, the only two right now that I will recommend. So I think it's super important for people to have a well-balanced diet. And it has been shown again and again that macronutrients from your diet are much more impactful to general health, and that includes hair health and skin health, than micronutrients that you get in supplements. I haven't been incredibly compelled by any of the data that's come out from these various supplement companies. And the other concern is that a lot of them contain mega doses of biotin, which we know can actually interfere with blood testing.
Thyroid testing. It's interfered.
Thyroid testing. I've seen this so much where women are taking supplements or just mega doses of biotin for their hair, which does nothing, by the way. And they'll be misdiagnosed as having a thyroid disease, put on thyroid medication. Then they're losing tons of hair because they're on thyroid medication that they don't need.
That's terrible. And it all started with the biotin supplement.
Yeah, it actually. Oh my God. There have been reports of people presenting to the emergency room having a heart attack, and it falsely reduces the blood work to confirm that someone's having a heart attack. This is true. So there's no benefit to taking biotin for hair. And the fact that it can impact labs like this, I just really tell patients to steer away from it. The reason why I do focus on iron and on vitamin D, two reasons. So ferritin is a specific iron marker that if it's less than 40, it's the best marker of iron deficiency. And even if a woman is not anemic, if their ferritin is lower than 40, they're just not going to grow hair as well, even with other medicated treatments. So I always recommend that people optimize their iron and get that ferritin above 40. And then the vitamin D insufficiency, that's because with vitamin D, it's been shown actually that if you knock out the vitamin D receptor in mice, the mice develop complete like a ton of hair loss. You replete that vitamin D receptor and the mice regain hair again. And there's a lot of conflicting data around it because these nutrition studies are hard to do. But at the end of the day, there's no harm in supplementing with vitamin D and there's a lot of reasons to potentially get your vitamin D into a normal range. And same thing goes with iron. And so those are the two that I do recommend. But these hair, marketed supplements, I usually tell people to steer away from.
Yeah. That's really helpful information on biotin, especially. What about, are there like any topicals other than topical minoxidil that work? You see all these, shampoos and serums, like anything that you found helpful?
No, I mean, they're through compounding pharmacies. We will sometimes compound different medications. So canrenone, for example, is the active part of oral spironolactone. So if a woman really doesn't want to use oral spironolactone, we'll sometimes work with a compounding pharmacy to do like a combination minoxidil, canrenone, topical. But most patients, like I was saying before, because we have very clearly looked at the safety profile of these medications, us and others, will be more likely to want to take an oral formulation simply because it's a lot less expensive, but also it's just easier to do because you don't have to put it on your scalp all the time. But most of these things that are not medicated, that are just kind of like ads that are thrown at us, don't do anything at all.
Yeah. And can you share about that? You shared about an exciting device yesterday, or can you share about that? Or is that confidential at this point?
No, so there is a microneedling device that's being developed, and full disclosure, I'm on the scientific advisory board now of this company. And so not all microneedling devices are created equal, but this device is actually clinical trials now. We did one in women, a small pilot trial before I was on the scientific advisory board, where we showed that microneedling of the scalp at a specific depth and frequency that supports hair growth can actually be very helpful in stimulating hair growth. And so I'm really excited about that coming down the pike as well, because I think it'll be another nice option for people.
Yeah. So, okay. So what I'm hearing is if you have hair loss, and it's bothering you and you've tried topical, let's say Minoxidil, see a hair loss specialist, not a trichologist, see a dermatologist, hair loss specialist, and that there are things that can be done. And I think it's really exciting, we've got the FDA approved topical Minoxidil, but to know that there are these innovations that are coming, like, to be honest, when my mom had her consultation with you, I didn't know about the oral low dose Minoxidil, I didn't know about the micro needling, but I think that's really, really exciting. And to see how SEEN can fit in, to complement and just really take the best care of your scalp, which again is the manufacturing plant for your hair, and reduce shedding by 44%. I just think it's very optimistic, and in the past there wasn't necessarily a lot of great things that could be done. So I just think it's very exciting.
Yeah, I agree. And, it's so, one of the best parts of my job is when we bring patients back and we show people before and after pictures, and they're like, oh my God, wow, oh my God. They can't believe the difference that they see. And just seeing people's reaction to that and how happy they feel and how much, like, you've seen their confidence coming back is really, really one of the best parts of my job.
Totally. And that's one of the best parts of my job too, because we get these amazing stories where people will call SEEN life-changing and game-changing. And, finally, their acne's improved, their dry scalp, and again, SEEN's not medicated, but it has all these benefits because it respects the skin and scalp. And then the hair shedding is just the, addition now, which we've been hearing about, but now we have the science where we can actually talk about it.
There was one question I saw come through the chat that I think is relevant to sort of talking about treatment, and that was on red light for hair. It's a really good question. So yes, red light devices have been FDA approved. Some have been FDA cleared for the treatment of female pattern and male pattern hair thinning, and they absolutely can work. However, it's very important that the light reaches the scalp. So if you have good coverage, and especially if you have dark hair, you want to make sure that light is able to get through the hair and onto the scalp. And so in some cases, that might mean that the handheld devices are a bit better in getting the light to the scalp because they can kind of comb through the hair as opposed to something that you set on the top of the head. And so that's the one thing. The second thing is, if you look at the studies, when they just did, when they measured in a small 2-centimeter circle on the scalp, how many hairs people got from baseline to 6 months using the light device, one specific light device, they showed that in that circle, the women who were using the light device actually increased the number of thicker hairs by about 20 hairs. So yes, it does work. The problem is that they weren't able to show women, like, they asked women, do you think you have more hair? And the women were like, I don't think I have that much more hair, but I will tell you, growing hair is like watching grass grow, and patients, I say it all the time, they do not appreciate the very slow, gradual improvements that they are making. That's why it's so important that patients see their before and after. Because you're looking in the mirror every day, it's happening so slowly that unless you have really good before and afters, it's going to be very hard to determine what's going on. The other word about laser light is it works for sort of mild to moderate hair loss conditions. For someone who has more severe hair loss, it's probably not going to be as effective.
Yeah.
So you might want to use it in combination with something else.
Super helpful. And I think, even the SEEN study was 6 months long, just like patience is important, but, making sure that it's working. We had another question, 2 questions I want. One's about ingredients, one's about hair coloring. So a couple of people are asking, what's the magic ingredient in SEEN? And my business partner, Greg, is married to my twin sister, and he is amazing. And he always says, it's not like we went to like a volcano at the top of the Amazon with a gold glove and picked this magic ingredient. Like, I think sometimes these, he says it better than I do, but sometimes these products talk about this magic ingredient, but what you are not putting in products is just as important as what you are, and it makes me think also about like what you said about the biotin, like certain things in hair products can can cause problems. And what SEEN has mainly done is to remove the pore clogging ingredients, the allergens associated with hair loss, common irritants. We definitely have good for skin additives in there. We have something called bisabolol, which is a naturally derived skin soothing ingredient. And we've got a number of other good for skin additives, but I think a lot of the magic for how SEEN is helping with hair shedding is really what's been removed. One of the questions was about hair coloring. Is there any relationship with hair coloring and hair loss?
Yeah, so that's a really good question. And I totally agree with you, by the way, with the removing and not including ingredients. Less is more. The old adage is very true. Less is often more when it comes to things like that. So with hair coloring, there's a couple of things to keep in mind. One, brown and black hair colorings can contain a ingredient called paraphenylene diamine, or PPD. If you Google PPD hair coloring, it'll come up for you. You really want to avoid that ingredient. We've seen that be a big trigger for inflammation in our patient population in general. The other one is ammonium persulfate, which can be in a lot of blonde or highlighting type color, hair color. So those are important to be aware of from sort of like a inflammation, kind of not so great for the hair follicle point of view. But you also want to be mindful of the fact that if you're coloring, especially bleaching hair or stripping hair like that with these harsh chemicals over time, it can lead to increased breakage of the hair as well. And that can make people feel like they're not growing hair as healthfully because the hair is breaking off before it gets to, a length that they want it to be at. And so you really want to be mindful of that and not overdo it, especially with things that might bleach or strip hair from a hair color.
Yeah, and for the paraphenylene diamine, even if you're not having any visible inflammation, do you think it's still important to avoid if you're suffering from, any kind of hair loss?
And again, this was based on a study that we did in patients who have a different type of hair loss, inflammatory hair loss. A lot of them didn't have any active like inflammation on the scalp. The scalp can be pretty resilient actually to things like that. But yet they had allergies to it. And what we were able to show is that if they avoided it and changed nothing else about their treatment regimen, they actually had improvement in their itch and improvement in their scalp redness when we evaluated them in clinic. So I do think it's important to pay attention to. And again, there are brown and black hair dyes that don't have that ingredient. So like there's no benefit to using it. So just
really, I found it, I don't want to call out any brands necessarily, but I've actually found it somewhat hard to find a good one without paraphenylene diamine, but that's good to know. I'll have to do a little bit more research. Yeah.
I don't want to be, I can't, but yeah, there are ways to find lists and things like that. Again, a dermatologist could help patients with that. There's a database that we can have access to that can basically give you a list of hair dyes that don't contain that.
Oh, that's great. Someone's asking if you can use SEEN with steroid injections for alopecia. Yes, absolutely. It's a again, it's not medicated. It's an adjunctive treatment, but there's no issue there at all.
And just want to make clear, alopecia just means hair loss. I think what you're referring to is alopecia areata. The person who wrote the question, alopecia areata is an autoimmune form of hair loss. And yes, for those, we do use steroid injections, but steroid injections for female pattern or other types of hair loss are not indicated. So I just want to make that clear.
For scarring alopecia, do people sometimes get?
Sometimes, but we try to avoid it if we can. Usually we'll use topical medications instead.
Okay. Someone's also asking for hair loss advice after chemo. Any suggestions on that?
Yeah, so while I don't want to give any individual patient advice at all, because I don't like to do that unless I've seen a patient myself, there are a lot of studies showing that in women who have experienced hair loss after chemo, that topical minoxidil, oral low-dose minoxidil, and even low-dose oral spironolactone can all be safe and effective treatments for women who are experiencing hair, sometimes women's hair doesn't grow in as robustly after chemo as it was before they had chemo. The other important thing for patients undergoing chemo to be aware of is that many medical centers also have something called scalp cooling that can be done to avoid hair loss when you're going through chemotherapy. So you should ask your oncologist about that as well.
Yeah, for sure. Okay. Were there any other questions in the chat, Maryanne, that you saw? I think we've answered a bunch of them.
So I saw one about, is spironolactone safe in breast cancer? And I can comment on that simply because there have been articles on that. There was one article that was recently done the past year that showed that yes, when they looked at women with breast cancer who took spironolactone versus those who did not, they actually saw no difference in recurrence rates or new breast cancer. And, I've talked to my breast oncology colleagues about this multiple times, and they all agree that it's very safe. So that's one thing that I can certainly help with. Oral minoxidil is incredibly efficacious. It works great. I think people are able to be more compliant with it because it's a medication that you take by mouth rather than rubbing things on your scalp again, which sometimes can be tricky. And doses that have been reported have been as low as 0.025, which would need to be compounded at a compounding pharmacy. But in regular pharmacies, 1.25, which is half of the smallest available pill. In women, I really try not to go above 2.5 because you have issues with increased facial hair and other things like that. But in men, you can go as high as like 5. Some people do 10 milligrams a day. So again, talking with a dermatologist about that can be really helpful.
Okay, amazing. Well, this has been so enlightening, and we're so grateful that you did this study. Again, at SEEN, we really are a mission-driven brand. We are not a marketing story. We're all about the science, and to have this randomized control study done at Harvard showing that fragrance-free SEEN and shampoo and conditioner can reduce shedding by 44%. With women with female pattern hair loss, and also for the entire group, the female pattern and scarring alopecia together, increase volume and reduce the need for camouflage is just really amazing. And it's really helpful to hear from you also what works and what doesn't work, because I know your interest in the study was, just like wanting to get more. Wanting to get more things out to people that actually work. So you're not spending your money, wasting your time doing treatments that, don't have the efficacy.
Yeah, my big reason for all the stuff that I do, and the reason why I do research, is because I saw myself and my own family members struggle with trying to sift through like what's real, what's not real, what's safe, what isn't safe. And what I say to my patients is like, I'm doing that work for you. I'm not going to recommend or do anything for a patient that I wouldn't recommend for a family member or do myself. And I really try very hard, like we did in this case, to put real evidence behind things. I think that's so important because, there's a big commercial interest from a lot of people trying to, take advantage of the fact that this is a very anxiety provoking thing for people, understandably. And so making sure that when you are investing in a product for yourself, that there's good evidence to back up their claims is so important. I can't say that enough.
Yeah. Well, we are so grateful that you joined us today. And if anyone has questions for me, you can certainly, email our support line at SEEN. We're still a small company where I get to see everything, but we're really appreciative to have Dr. Maryanne Senna, hair loss expert, joining us today.
Thank you for having me. This was a lot of fun, and I hope it was helpful for people.
Yeah, me too. Really appreciate it. Thank you.
Take care.
Bye.
Bye.